And I'm just going to really condense some of his history. He's 65 years old. He had an onset of pain about 7 to 8 months ago, correct?
Yes.
It was a slow onset. It didn't come on suddenly. You didn't have a fall or an injury or anything like that.
No.
You haven't had a vaccination in your arm.
No.
You're not diabetic, and you don't know if you have a thyroid issue or anything like that.
Correct.
Okay, so what I want to do today is just kind of demonstrate how I tease out if he has a rotator cuff problem or if he has a frozen shoulder. We're going to be talking about frozen shoulder specifically, but let's just kind of take a look at this and see how he does. So I'm going to have you lift that arm straight up overhead. Okay, so he's able to pick it up, but see, he can't get it way up here like this, okay? He's lacking about 20, 25 degrees. Now back down. We're gonna bend your elbow. I'm gonna hold your elbow next to your side. I want you to bring your hand out toward me. So external rotation is limited to maybe about 5 degrees, okay? Notice if I grab a hold of him and I try to go a little further, I really can't. It feels pretty snug and tight in the front here. Okay, now I want you to relax. I'm going to lift your arm up and watch what happens as I lift him. He starts to shrug up here because he's so tight in here that it's bound up as I lift his humerus. His scapula wants to go up too, and this starts to shrug. But notice this part just doesn't want to drop all the way down here. It's very limited. So he's super tight in the back of the shoulder, and the shoulder wants to pop up even more. Okay, and so when I take him out to the side, again, if you hold it there, he's got good strength. Hold it tight. Don't let me push it down. Hold, hold, hold. Good. Bring it straight ahead. Hold it here. Hold, hold, hold. Good. Down by your side. Don't let me push it in toward your belly. Hold, hold, hold tight. Now bring it in toward your belly and hold it tight there. So he's strong. His rotator cuff is strong. We're going to do one more here just to isolate your supraspinatus muscle here. Hold tight. There you go. Good. So there's no giving way. There's no obvious rotator cuff problems here. His biceps might be a little tender, and his pain level is kind of in this region here, but no mechanism of injuries, and this was a slow onset. So I have to be suspicious that he has a frozen shoulder or adhesive capsulitis because he has a limited range of motion in all positions: flexion, external rotation, internal rotation passively, and abduction. The shoulder blade starts to come right out here. Okay, so he can't get that arm cleanly over the top, and as a result, even though he has a good rotator cuff, he has abnormal motion, causing a lot of pinch in the shoulder and, limiting some of his function. Although he stays very active, he still has this this tightness. So the way we're going to address this is we're going to optimize his mobility first. We're going to teach him how to stretch. We are going to stretch him also and get the motion back, and then we're going to work on posture strengthening, rotator cuff strengthening, and maximize him there, and I'm sure he will do very well. We did get an x-ray on this because people with severe arthritis in the shoulder can present just like this, but usually with a little more noise in the joint. So this is a classic example of a frozen shoulder that just is not resolving completely on its own, although it can continue to see some improvement over time. We're going to be able to accelerate that quite a bit in therapy. And hope you enjoyed today's video. Hope you understand adhesive capsulitis or frozen shoulder a little bit better just by seeing this demonstration. And Randy, thank you very much for helping people learn what you have here. And this is going to make it better for everybody. So if you did enjoy our video, please give us a thumbs up and be sure to subscribe. Thanks.